Well, all right, we're here with Dr. Zymantas, dentist. And Dr. Zymantas, tell me, there's lots of talk out there about, people sometimes they're missing a tooth, maybe 2 or 3, all the way in the back somewhere. And not much bad things have actually happened. And yet, every dentist will basically tell you, you've got to replace your teeth. And yet, after having a couple, 2, 3 teeth missing for a while, not all that much bad stuff has happened. So what's the story? Can you shed some light on it?
Well, ideally, most teeth that would be missing should be replaced. Not all teeth, of course. Wisdom teeth say, and realistically, you can lose maybe your second molar and live well with just what's called the first molar occlusion, which is having all of your teeth, including your first molars, and that would be sufficient enough. But if you lose more teeth than anteriorly, then all your teeth start drifting and shifting. Periodontal issues, meaning bone loss, can occur around the teeth. Things become more difficult to clean around teeth that have been missing, and over time you can start changing the kind of shape of your face, and you may get a sunken in looking face, and you will certainly have your facial features will look significantly older over time.
Well, that's definitely not a good thing. I mean, that's probably one thing which most of us do not think of, that actually having teeth missing, and then because of the tooth missing, I guess what you're saying is the bones start shrinking, the arches start shrinking, and you start like having that caved-in look, the way old people look, and missing teeth advance that. That's what you're saying.
Yes, absolutely. The facial features start changing, and everybody has seen probably, especially cartoonish kind of characters, exaggerated, but people that have missing teeth, their facial features are collapsed, and it's significantly, it's unattractive.
Yeah, definitely. And I guess all the people who were wearing dentures, that's literally what happened to grandma and stuff. We still have that impression of, when we don't see her for a year or 2 or 3, or him, all of a sudden we realize they're like all, caved in. Now, something else some dentists have told me, and that is, basically because you have some teeth missing, so what happens is you start chewing one-sided, which in itself not a big deal, but yes, coming from an engineering background, if you have hinges and you use one, or you have cogwheels which are not adjusted, and basically one gets more used than the other one, they break. But before they break, they get out wacko. So is it possible that because of this type of missing teeth, that one can get neck pains, tensions, and maybe even headache, like some people say? I mean, some dentists have told me that is definitely an occurrence. What do you think about it?
Yes, that's true. The ideal situation would be to have what's called the balanced occlusion, where you are able to use both sides of your mouth for chewing and biting to properly more or less balance the situation out. When you are out of balance, then you are using one side more than another, and you will potentially cause temporomandibular joint problems, neuromuscular problems in the head and neck from, again, overuse of your musculature system in the wrong way. So yeah, you definitely ideally would like to have a balanced occlusion. Balance is important in just about everything in life, and especially in chewing and eating.
Well, I can definitely see that. And exactly what does the word occlusion mean?
Occlusion is the science of how teeth interrelate with one another, how the bite functions one tooth with another on either opposing, the teeth on either side, or teeth side by side.
So like cogwheels running smooth rather than like in some way crooked and aching and then eventually break and the machine comes to a still stand.
Correct.
Well,
correct. You want the gears to be meshing properly. And if the gears aren't properly lined up, then over time either the machinery controlling the gears breaks or the gears themselves break, or a combination of both.
All right. So what I got out of it is we have two things here happening, and I think both of them are equally devastating because, looking ugly, and just by ugly, just looking a few years older, it's just not what, even guys or girls, I don't think any one of us want that. And the other one is tension in your neck, not being able to sleep nicely through the night, here and there a headache. I mean, the world isn't made to have that, and both of them, are just not good effects. So I think one should go and look for a dentist and get those things fixed and at least checked out whether they have an impact on headaches or stuff like that.
Correct. I agree. Yes.
Thanks a lot, Doctor. I'm sure we're going to speak to you lots more, Dr. Zymantas, and I hope that this information was and is helpful to the viewers. Bye-bye.
Thank you. Goodbye.